Hi everyone, thank you for joining. Welcome to our video on Medicare Supplement or Medicare Advantage. Which one should you choose? I'm Jonathan Schinkel. I am the owner and primary agent of Health Horizons Medicare Solutions. We are a local insurance agency. We serve several different states. We're based in Virginia, North Carolina, South Carolina. Happy to meet with you in person if you would like our assistance. You can see our first video for what we offer as insurance agents and an insurance agency. Of course, no cost, no obligation to speak with us. We're happy to chat with you about your situation, so feel free to send us a message, email, phone call. You can call or text. Numbers on the website, and you're welcome to peruse our website, use any of our information, reach out with any questions. Again, we hope that this information is valuable, that you find this content helpful and educational. And all that we ask in return is that you would reach out to us when the time comes to get started with your Medicare. Let us help you navigate this complex and process of getting your Medicare set up and choosing a plan. So if you find this video helpful, drop us a like, give us a thumbs up, subscribe to the channel, and we're going to go ahead and get started with Medicare Supplement or Medicare Advantage. Which one should you choose? If you saw our overview video, you know that Medicare Advantage is known as Part C of Medicare. Now, in addition to that, we have what is called a Medicare Supplement policy. Medicare Supplement policies are plans that are standardized by the government, and they are made to provide a solution to those high costs of deductibles, co-payments, and coinsurance under original Medicare Parts A and B. Now, if you watched our first video, you know all about what the costs are to have Medicare in general, what the deductible is if you go in the hospital, or if you get outpatient medical care, what your deductible and coinsurance is. A Medicare Supplement policy, or casually known as Medigap, helps to fill in those gaps that Medicare leaves behind. What are those gaps? Again, it's $1,600 should you go in the hospital, and 20% of the cost of any outpatient medical care, doctor's visits, laboratory tests, diagnostics like MRI, CAT scan, surgery, kidney dialysis, cancer treatment, things of that nature. You are going to have to pay 20% of those costs with no annual max out-of-pocket limit. So it's very important to either add on a Medicare Supplement or a Medicare Advantage to help protect you from those extremely high costs. Now, a Medicare Supplement policy, these are easier to understand than Medicare Advantage. As I noted in the first video, Medicare Advantage probably has 20 or 30 options in your state of different Medicare Advantage plans that you could choose from. Each one is going to have different copays, different benefits, different max out of pocket. It's more complex. It doesn't mean that it's worse. It could be the right thing for you for sure. But Medicare Supplement policies are standardized by Medicare. The insurance companies only differ in the price of what their pricing is for that particular policy. Most pricing is based on your age, so it does increase each year as you get older. And you can look at the documents for a Medicare Supplement policy, and you can see what's called a rate sheet. That is going to show you at age 65, 66, 67, and so on, what the rate is going to be for that particular Medigap policy. Now, in addition to that, of course, with inflation, things like that, the insurance companies will raise the price by a percentage every year. And so those things are reissued. So expect yours to go up, on average, maybe 5% per year between the price difference of your age and the insurance company raising the prices across the board. Now, Medicare Supplement policy can only be purchased with traditional Medicare. You need to choose one or the other. You cannot purchase this with a Medicare Advantage so that you get the benefits of Medicare Advantage, like the gym membership, the dental, the vision, grocery money perhaps, and get a Medigap. You have to choose one or the other. As I already mentioned, this covers pretty much all out-of-pocket costs with Medicare Part A and Part B. It's going to cover that hospital deductible most likely, especially if you go with one of the most popular choices like Plan G or Plan N. Those are going to cover fully that $1,600 deductible at the hospital. If you're turning 65 after 2020, no plan is able to cover the deductible at the start of the year for Part B. That is the first $240 of medical bills. You're going to have to pay that out of your pocket. Then your Medicare coverage is going to begin once that deductible is met, And if you go with Plan G, is going to pay your share of the 20% for the remainder of the year. This means it's like a buffet. You could essentially, you pay your monthly bill, but you could get whatever you want out of it. If you get a paper cut and you want to go over to the emergency room, you could do that every single day, and you're not going to get a bill if you have Plan G. Plan N, it works a little differently. You're going to have a copay at the ER or at a doctor's visit, but otherwise, you can get surgery that's approved by Medicare. You shouldn't have any out-of-pocket cost. MRI, CAT scan, approved by Medicare, shouldn't have any out-of-pocket cost. Again, I say approved by Medicare because you have to read into the details of different procedures, what's approved by Medicare and what's not. One helpful thing is if you get your cell phone, and you download an app called What's Covered. It says Medicare. That has an easy search tool where you can look up different procedures and see what's covered. Of course, you can do a Google search online as well. CMS.gov or Medicare.gov are the government's websites, resources like that. Now, as I mentioned, it's like a buffet, and that's how I describe it. It is expensive. It's going to have a monthly cost that you have to pay. But it is robust coverage and is kind of the peace of mind option. You have no unpredictable, large copays. You're going to have no network restrictions like a PPO or HMO. You can see any doctor that takes Medicare. And you also can change to a Medicare Advantage plan down the road in the future at any time. Each year during open enrollment, you'll have the option to shop for plans, decide if you want to stick with your Medigap plan or try Medicare Advantage. Now, it doesn't always work out the same way around. If you choose Medicare Advantage to start out, and then more than 1 year goes by, which is your trial period, is what Medicare calls it. More than a year goes by, and you want to apply for a Medigap policy, you are going to have to go through underwriting, which is where the insurance company asks a long series of questions. Looks at your medical history, your current prescriptions, things like that, usually going back about 5 years, and you could be turned down, declined for a Medigap policy. So your window really is that first 6 months that you get Medicare Part A and Part B. Even if you delay Part B because you're still working, you're happy with your employer group plan, you add Part B, say, when you're 68, you have a 6-month window called your open enrollment time for Medigap, where you can choose a Medigap policy. Otherwise, should you choose a Medicare Advantage plan, you have 1 year, that trial right, to try it out, see if you like it, and you'd be able to switch to a Medigap policy, no questions asked, if you would rather go that route. All right, what is Medicare Advantage, known as Part C? This would happen after many years of Medicare being in existence. Congress created a way for people to get their Medicare coverage through a private insurance company. Now over 50% of Medicare beneficiaries are enrolled in a Medicare Advantage plan, as opposed to original Medicare plus a gap or a supplement policy. So like I said, Part C, Medicare Advantage, this is a whole comprehensive health plan. So it covers hospitalization, covers outpatient medical care, doctor's visits, lab work, testing, things like that. Typically is going to cover prescription drug coverage also. And in addition to that, usually is going to offer dental, vision, hearing, some things like that that are not covered by Medicare. And that may come as a surprise to you. Dental vision is not something that Medicare covers for routine dental or vision care. You have to buy that separately on your own, or you can get it as perhaps a benefit of a Medicare Advantage plan. Now, when enrolled in a Medicare Advantage plan, you must receive all Medicare services, that is Part A and Part B medical services, through that plan. And that means if it's a HMO or a PPO, you likely are going to have a network of doctors that you're going to have to stay inside of that network of doctors. Otherwise, that plan is not going to cover that service. Specifically with HMO, PPO may offer out-of-network coverage, but it may be more expensive. Some examples of companies that are approved to do this: United Healthcare, Humana, two of the largest, Anthem or Blue Cross Blue Shield, depending on what state you reside in, Aetna, Cigna, WellCare, ClearSpring, many, many different companies getting into this business. Now, most of these plans in most areas, and the areas specifically that I have lived and worked around the Mid-Atlantic, are going to be 0 monthly premium plans. Now, that means in contrast to a Medigap policy where you pay a monthly premium that actually goes up each year as you get older, you could have a plan that has a $0 monthly premium, no cost. That means the only monthly expense you would have is that $174 per month for Medicare itself for Part B that they either take out of your check or charge you if you're not receiving Social Security yet. Now, in addition to that $0 premium, not everything is free. You're going to have copays and coinsurance for different services, but you will have a maximum cap or limit for the year that protects you from extremely high out-of-pocket cost. Some copays, like maybe a primary care doctor visit, lab work, preventative services, those are going to be zero, no cost. Other copays may be, negligent or minimal. Specialist visit, things of that nature. Other things like an MRI or CAT scan could be a couple of $100s, depending on the plan. And some very, high cost medical procedures, for example, cancer treatment or dialysis for end stage kidney disease, could be a coinsurance of 20%, just like regular Medicare, where you are likely to go all the way up to that cap and hit that cap of your max out of pocket for the year. So this means that Medicare Advantage, even though it's $0 a month, it doesn't mean you're not going to spend anything or that you're automatically going to save money that you would have spent going with a Medigap or supplement policy. It just means that you have the potential to save money, and looking at the long term, 10, 15, 20 years of paying a consistent monthly amount for a Medigap, Part D, possibly dental or vision plan every single month, what that adds up to versus, occasional services, maybe even occasional major services with a Medicare Advantage plan. These things could add up to either be the same, or you could save a good bit of money with Medicare Advantage. Or, perhaps if you're very unhealthy or have some serious medical issues that come up, you could end up spending more in the long run with Medicare Advantage. It just depends. And this is what you have to evaluate when you're getting Medicare. Now, speaking to some extra benefits of Medicare Advantage, like I mentioned, it does come often with dental and vision and coverage included. That's great. Usually a gym membership, maybe through a program like Silver Sneakers, potentially an allowance, money for over-the-counter products, things like vitamins, pain relievers, toothbrush, toothpaste. A lot of plans offer that over-the-counter allowance. And most recently, in the last couple of years, we've seen a lot of plans as an incentive, giving you a monthly allowance that you can use for groceries or utility bills. Pretty impressive stuff that is coming with these plans that is a value-added benefit, and you should take into your calculation as you're budgeting what to spend on your health insurance. Now, how has Part C changed Medicare? This is something I always like to touch on when I do these seminars. As I mentioned before, Medicare Advantage enrollment has now surpassed 50% of the people with Medicare across America. Certain states it's lower, certain states it's much higher. But the benefits, continually expand each year because the government reimbursement rates to these companies continues to rise each year, as well as the bonuses that they pay these carriers and things like that. So these increases, vast majority of that must be spent on increasing benefits for plan members. So whereas a Medigap policy, you see the cost kind of steadily rising each year because there's no government involvement in actually paying the bills. It's simply traditional insurance. Medicare Advantage is a program of the government where the companies are paid directly based on each member enrolled and the risk profile of those members. Getting down into the weeds a little bit, but want you to understand how it works. There is an allowance essentially allotted to these companies. So the healthier their members are, the more money they save. And they can't just take that as a profit, and give their CEO a giant bonus. They have to invest that into the actual benefits of the plans themselves. And so we see the cost going down with Medicare Advantage. Premiums, when I first started, were $50, $60, even $90 or $100 or more per month. Now most premiums are zero. Dental was never something that was included. It was always an add-on service that you had to buy. Now it's hard to find a plan that doesn't offer any dental coverage. This also means that competition has increased dramatically. There are many, many companies jumping into this Medicare Advantage program, wanting to get a piece of that pie, and that healthy competition does create plans, lowering costs and adding richer benefits. Last thing I want to touch on is how this affects Medicare. And this is important, is the traditional Medicare supplement rates are going to continue rising. This is due to a smaller risk pool. Insurance is all about balancing risk and cost. And when you take, generally speaking, probably people that are healthier and they are leaving that pool, going toward a Medicare Advantage plan. People that are sicker are more prone to stay with the supplement because of the security of what that provides. You have a smaller risk pool. Therefore, the insurance companies must compensate and the rates are going to rise. So, to summarize, there's two ways to get your Medicare insurance. Number one, original Medicare plus a Medigap policy plus a prescription drug plan. And then optionally, you may add on dental or vision. Again, ballpark costs, just to recap, $174 per month for your regular Medicare Part B. Could be higher or lower based on your income. Medigap policy, that is going to rise each year. If we take a ballpark average, maybe $100, $120 a month, the areas where I tend to do business, could be going north of $250 or $300 by the time you're in your 80s. So something to budget for, how that rises. Plus a Part D plan. Now, Part D plans nationally average about $30 to $40 per month. There certainly are ones on the lower end of that have a big deductible, and ones on the high end of that towards $100 or more per month that have no deductible. So it's something to consider as you look at it. Again, overwhelming and confusing. Sit down with somebody like me, preferably me, contact us, schedule an appointment. We'd be happy to review that with you. Now, option two, of course, Medicare Advantage plan. This covers your Part A, Part B, and Part D, and usually includes dental, vision, hearing, and other benefits included. Now, like we said, $174 a month for Medicare, at least is the standard rate. Medicare Advantage generally is going to be a zero premium plan. Of course, that depends on where you live, but by and large, we're seeing a trend towards zero premium plans. Then what's any additional monthly cost? Well, we could add on what's called a hospital indemnity plan. Think AFLAC. You end up going in the hospital, maybe on your Medicare Advantage plan that costs $300 a day is your copayment. So 2 days in the hospital, that's $600. But you could add on a plan called a hospital indemnity plan that's going to reimburse you for that expense. That may only run you $20 a month. So that could be a good option to add on if you go the Medicare Advantage route. And you also have the choice of a critical illness plan. Now, as I mentioned, we operate and offer life insurance, final expense, annuities, things like that as well. Critical illness means cancer, heart attack, or stroke. Now, we could get you benefits for that through a life insurance policy. That's worth looking at. Or go with a critical illness plan that will pay you a cash payout. You decide how much you want to buy, how much coverage. And upon diagnosis of cancer, heart attack, or stroke, you will receive that cash payout. And that will help you to cover the medical bills, copays associated with Medicare Advantage, or just general life expenses, loss of income. Now, how should we evaluate our plan choices? Now, I've already touched on many of this. Do you want insurance that covers and has no copays at the doctor, no network to deal with, and you're willing to pay for it? Can you also afford paying monthly premiums that are going to rise over time? If that sounds like a good option, then a Medicare supplement policy plus Part D is probably right for you. Or do you want a zero monthly premium plan that includes medical, prescription, dental, vision, all together in one plan, maybe simplified? Biggest selling point probably is that zero premium, and then you only pay for what you use. How do you feel comfortable staying in network and having copays for various services? If that sounds like a fair trade, Medicare Advantage may be the right plan for you. Either way, you're going to have to spend money, but it's something to be aware of how you want to spend that money and how things are going to add up to over the long term. Now, number 5 here on the page, list your medical providers. Do all of my doctors, hospitals, surgery, imaging centers accept my coverage? We're happy to check on that for you. We know how to do that, and we'll help you through that process. Number 6, list your prescriptions, medicine. Are your medicines all covered by the plan you're considering? We can help you look at the formulary to determine if they are or not and what the costs are going to be. Number 7, do you have a traditional supplement policy now and a Part D plan? You should evaluate if those high premiums that do rise each year are worth paying compared to the zero premium plans available. So you should weigh your annual cost now versus what they could be under Part C Medicare Advantage, and look at the extra benefits like dental and groceries that are available with Medicare Advantage as well. Now, this may be a situation where you decide, far and away, you don't want to deal with Medicare Advantage. You want the stability that comes with the supplement policy, no network, no surprise expenses, things like that. If that is most important to you, then by all means, stay with your supplement policy. Or if you're new to Medicare and that sounds like, according to your value system, what's important to you, that's the way that you want to go, absolutely makes sense. We'll help you sign up for the right supplement where the rates aren't going to rise too much, and you're going to have the coverage that you need. And then again, we'll do another video here on timing, but every October, you want to check during open enrollment to see if your current plan is still competitive, is still the right fit for you, or if there's something else that gives you potentially better benefits. And of course, ask a local expert like me. Feel free to contact us, schedule an appointment, give us a call. We are happy to help you. Last thing I'll say here is let's avoid deception and bad advice. As I mentioned at the beginning, these call center agents, these marketing agencies are going to be extremely aggressive through the mail, things that they send that looks like a government notice. It's just an advertisement, so-called Medicare helplines that you see with Joe Namath on the TV. These guys, or which they're also doing illegally, contacting you by phone. They're not supposed to do that. That goes against Medicare regulations. But you better believe every day you're going to get 5 or 6 Medicare calls. These have deceptive and predatory sales practices and oftentimes end up enrolling that person without their consent. If you give them any piece of information like your Medicare card number or something like that, oftentimes they will just sign you up, tell you it's no big deal. They're just giving you extra benefits. And in reality, you're going to end up with a completely different plan that may not work at your doctor's office, things like that. So be careful with who you talk to. So going along those lines, number 2 there, don't give your Medicare card information to anyone other than a licensed agent you trust who is enrolling in you in the plan you are choosing. Verify the plan information you're given directly with the plan's materials. Agent, someone like me who's reputable will always give you the materials directly from the insurance company, not something written on a napkin or a scratch piece of paper or empty promises over the phone with nothing to back it up. Lastly, Medicare.gov is a great resource. Even friends and family who are well-meaning can share wrong information. This stuff is just extremely complex. A lot of regulation, things change. There's a lot to be aware of, and it's not cookie cutter. It's not a one-size-fits-all. Your situation likely is going to be different than your siblings, than your friends or your neighbors. And so you want to understand all of the pieces of that, how they work together. And then you want to verify those facts and information before you make a decision. Again, what do I think the best way to do that is? Well, hey, a free resource like me, somebody who's a local agent you can depend on, form a relationship with, we're going to put everything on the table, look at all of the pieces, and help you navigate and make the best decision for you and your family. So thank you so much for tuning in today. Again, feel free to browse our website, send us a message, schedule a call. We are happy to help you. Take care.